Due to the graphic nature of this program, viewer discretion is advised.
Get them on IV fluid.
Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.
She's got a spontaneous pneumothorax, so we want to continuously suction the air out. Okay, somebody want to scrub real quick? Small little incision in through the skin. Grab this. And you always want the incision to be the size of the tube and not bigger. I'm going to measure to the front of the chest cavity, which will be right here. So it'll be
halfway between the second and third.
Halfway between the second and third. Okay, I'm gonna go on through to the chest cavity, and as soon as I come around this side, Mona, you hold this, and Dee, could you clamp it off as soon as we get in there, please? So as soon as I tell you, I'm just making my way through the sub-Q. And now I'm poked into the chest cavity. Go ahead and feed the tube in.
With the stylet.
Over the top, in between my stylet there. And then slide your stylet out when you get into the chest cavity. Go all the way in. Okay, now slide it out. Clamp, please. All right. Now we should take an x-ray. Make sure that we're into the chest cavity and we're in the right place. So now we're removing air from the chest cavity. We have the chest tube in place. Unclamping, removing the air out. And what we're going to do now is hook up to continuous suction. So we're going to create a vacuum. Yep, now there's no more air in there. So the cat is very stable, normal.
It's a PLN cap.
ECG, blood pressure, pulse ox. So we'll hook it up to a continuous vacuum system. So keeping the chest so that the air is pulled out continuously. Hopefully that'll put pressure on the lung that's got a hole in it, and it'll seal it up after 2 to 3 days. So that's kind of the plan of action. So now we're going to suture in place. We have to suture it to the ribs first. So they're going to grab a hold of the periosteum of the rib. And that'll anchor it into place so the cat can't pull it out. Some of these, they never resolve, and then you have to ultimately go in surgically to try to repair the lung. Even take that whole lung lobe out that is causing this leakage. The loop is used so that we can pass a needle underneath the loop and go around the chest tube so it's not pinching the skin. Because if it pinches the skin, they're going to try to get the tube out. They're going to turn around because it hurts. So this is like a modified Chinese finger knot, it's called. That's the type of suturing pattern it is. Okay, so now she'll loop through there, and then she'll go around the tube. This is a pretty rare occurrence. I've only seen in 20 years 2 other cases. So it's fairly rare in cats, more common in dogs, particularly certain breeds. And usually you know that it can't come out because you can't pull it out. We're going to just put a suture across here and then around the tube once more. And then to close the skin here. And we'll have to place an E-collar on the cat, Elizabethan collar on the cat, to prevent him from turning around and pulling out the tube. And here goes the major nursing power, because it takes a lot of nursing care for these guys. We keep him on a fentanyl ketamine constant rate infusion to keep him calm and out of pain. This is not a really painful procedure. We used a local anesthesia, but we just don't want him waking up and moving around so much. We're going to have a long extension on this where it's going to be hooked up to the suctioning pleurovac or thoroughvac, and the machine's going to take off air constantly. They have these, they're actually made for people. We buy them from a company that makes them for people, because people will sit with chest tubes in the hospital and they drain directly into this equipment. So we have developed it for use in cats and dogs. We're keeping this netting on so that fit him with a nice sweater. No. And then put a hole, obviously, right through here so the chest tube comes out. So the owner is actually a technician that works at one of our local referring veterinarians at Wauwatosa Animal Hospital. So she's waiting on pins and needles for me to call her, because I said things could go bad for this. Sticking a tube into the chest cavity is always risky, because one little poke and you poke into the lungs and it's all over. Okay, tie that in. Let's take them back. That was amazing, man. Unbelievable. So now what we're doing is Ethan's going to hook up the thoroughvac, and it constantly pulls air in through the water and in through the machine and out the system, so that you can create a seal in the chest cavity so there's no air in there 24 hours a day. they live on this machine, and it constantly keeps negative pressure in the chest cavity so that you can keep the chest cavity emptied and then create a seal on the lung that's disturbed or has a hole in it, and let that seal off and heal, and hopefully put like a band-aid over it. It seals off, and then we can take them off this machine. So
you have like exercise restriction, anything?
yeah, as much as possible.
Really? Okay.
Yeah, as much as possible. I would like, do you have other cats and everything? You do, okay. So if you can keep him separate from everybody else, just kind of hanging out.
Okay, no jumping on the
Couch
counter.
potato, yeah, exactly.
Like where he lives.
Yeah.
Okay.
And then, like I said, you'll just take off the wrap. And then there's a vet wrap around there, just to seal up that hole underneath where the chest tube was. And then I'll have you just watch him and make sure.
Okay.
Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, Metropolitan Fence, we're always on the level, and Camp Bow Wow, Premier Doggy Day and overnight camps. And now, a word from our sponsors.
Welcome to Camp Bow Wow in Waukesha, the premier doggy day and overnight camp where a dog can be a dog. Our campers play all day in our 4 large indoor and 4 outdoor play yards. Watch your pup from anywhere in the world on our high-speed camper cams. Our certified camp counselors, spacious cabins with comfy cots, pup pools, and outdoor play equipment ensure that your pup has a great time. We're open 365 days per year for your convenience. Stop in for a tour and book a reservation for your dog's free day of camp. Visit campbowwow.com/Waukesha or call 262-547-WOOF for more information.
At Metropolitan Fence, we have been keeping your children and pets safe in southeastern Wisconsin for over 27 years. We offer a full line of residential and commercial fencing, from vinyl, wood, ornamental, and chain link. For a free estimate, please call us at 262-547-6001 or visit us online at metrofence.biz. And remember, we are always on the level.
The Humane Animal Welfare Society of Waukesha is so much more than a shelter. Our adoption staff, animal caregivers, and behavior department ensure the best possible adoptive companion. Our spay-neuter programs actively combat pet overpopulation in our area, and our animal rescue team safely returns lost pets back home. PAWS does one-on-one consultations, holds a variety of training classes and seminars, and even hosts camps for kids. Our shelter is and always has been open admissions and full service, providing resources for pets and their people for a happy lifetime together. PAWS, we're building a society that's humane.
Boarding, grooming, training, and more. When it comes to your pet, Animal Motel is their home away from home. At Animal Motel, we offer a top-of-the-line facility with boarding suites for both dogs and cats, outdoor play yards, a training hall, and so much more. Whether they're here for obedience training, grooming, or an extended stay, we promise your dog and cat will be part of our family. Animal Motel, personalized care for your precious pets.
Looking to get some training for your dog? For Pet's Sake is your one-stop dog training center. We offer all-inclusive obedience training, canine sports training, specialty classes, and more. We provide training classes in 3 convenient locations with our main facility in Mukwonago, which boasts a fully matted 5,200 square foot training hall. While in Mukwonago, check out our Bichon Buddy Rescue and take home your new pet. Bichon and Little Buddies Rescue takes in Bichons, other small dog breeds, and cats that need to be rehomed for various reasons.
You are really, really, really cute. So the puppy was not doing well this morning. The owners just came home to find it really lethargic, not feeling well. We just took the temperature, and the temperature is 104, so that's pretty high for a little puppy. He's really dehydrated. He's got some kind of an infection going on, so we're going to get some more history from the owner and try to figure out what's going on with this little puppy. So, what's going on with the puppy?
Alrighty, so what we have is basically a 3-month-old male Yorkie mix who owners just got about 8 days ago from the pet store. They had noticed that everything has been going great up until this morning, where the puppy started acting a little bit more lethargic, didn't really want the breakfast, didn't really want to be walking around so much. They also noticed a little bit of sneezing and maybe a little bit of gagging as well. But when I also palpate his trachea, I get a cough every time, kind of palpating the trachea. And with the history of kind of coming from a puppy store with lots of other puppies around, and especially 8 days later, which the incubation period for kennel cough is about a week, I'm pretty concerned about that. So the owners gave me the go-ahead to get some radiographs and also some blood work from this little guy, and see if we can kind of come up with a diagnosis from that.
Puppies, being so young and not having a fully developed immune system, they'll get pneumonia, end up getting pneumonia because it'll go right into the lungs. So it's just like a child versus an adult. If you get a little cough, cold, you just go on your way, you take a little cough medicine and you move on. Whereas a little tiny baby gets a cough and a cold, it can turn into pneumonia just like this because their immune system isn't fully developed. So this is the little puppy. This is the puppy laying on her side. So the spine is up here, front legs, and then this is the chest cavity with the heart being here. And then there's all little spot areas here, which is infiltrates in the lungs. Obviously, just as we determined, he does have pneumonia, and that's what's causing the fever. So we'll keep him back in isolation and then put him on IVs so we can get his temperature down, and then put him on IV antibiotics too.
We are gowning up so we do not touch the animal and then touch other animals. We will of course wash very thoroughly after, but just as extra precautions. We do not want the diseases in here getting out into treatment.
Just wants to like snuggle. Oh,
You're really cute.
Yeah, you're good, puppy.
We had to give some pretty hefty sedation just because they're a baby, and it's just like a little child. They don't understand, you know. Older pets, you can kind of console and talk to them. They've been through things at their vet before, and they've kind of been exposed to veterinary offices, shots, everything. This puppy came directly from a pet shop, so it's never had anything done to it, so it doesn't understand IV catheters and all these kinds of things. So he's getting that put in, and
Throw stuff at
she's right. I know, you're okay. It's all done. Right, the worst is over. Right.
There's been a lot of excitement at Haas this year, from newsworthy animal rescues to helping everyday people adopt a new family member. We at Haas know we couldn't do it without the help of people like you. Help us continue our success in fulfilling our animals' needs by donating to the Haas Two-Step Project. By making a general donation and pledging to donate toward our much-needed future expansion, you help us continue the Haas mission of helping animals in need. Log on to haaspets.org and donate today.
Humane Animal Welfare Society.
Because you love him completely, because he is part of your family. When your pet needs emergency care, you want the very best trauma and critical care specialist standing by. You know there's only one place you can trust and always count on.
I thank MECA and Dr. Derek Crescent for the medical care for Bailey.
Dr. Crescent and I are very happy that we were able to provide medical care for Bailey and all the other Milwaukee Brewer player pets.
At Metropolitan Fence, we have been keeping your children and pets safe in southeastern Wisconsin for over 27 years. We offer a full line of residential and commercial fencing, from vinyl, wood, ornamental, and chain link. For a free estimate, please call us at 262-547-6001 or visit us online at metrofence.biz. And remember, we are always on the level.
For over a decade, Fetch magazine has examined the unique bond humans have with their canine companions by publishing popular dog-related topics. With a strong commitment to dogs in need, Fetch also prints local adoptables in each issue, supplies affordable advertising to businesses, and gives rescues 30% off of ads. This year, Fetch is offering $15 subscriptions for your convenience. For more information, visit www.fetchmag.com or pick up your free copy at a local pet establishment near you. Go Fetch!
This is an 8-year-old kitty. It's a male-neutered kitty that presented here about a week ago. And the cat was vomiting, not doing well, not eating. And we got some blood work. The cat does not have a very friendly attitude. It's very fractious. And the owner knows that because she's brought it into clinics for vaccines before, and she's always had problems. The cat's tried to attack the veterinarians. So just to get near to the cat, we have to give drugs. So when he came in and was admitted to the hospital, we had to give him some sedation. We got blood work and found out that he has kidney disease. Very early stages of kidney, but it's called a protein-losing nephropathy. So it's very sad because the cat's only 8 years old and has this type of kidney disease. We gave the cat IV fluids and got the cat feeling better and eating, and then sent her home, and she was giving sub-Q fluids at home. The cat went home and ate for the first couple days and then stopped eating for about 4 days now. And so she brought the cat back. So we're going to place a feeding tube in the cat's neck that goes into the neck and down into the esophagus, and then stops about right at this point, just above the cardia of the heart, and we'll use that as a feeding tube, and then she also can give fluids through that feeding tube. So Chad's going to prepare the left side of the neck. That's where we put the feeding tubes. So once we put it into the esophagus, we can, the cat will walk around the house with a tube in permanently and doesn't even bother it. They act like it's not even there. We're going to put a little gel on the laryngeal folds of the cat. Cats are really hard to intubate. Sometimes they close up their epiglottis, where you put the endotracheal tube into. So we're going to put a little lidocaine gel, and that numbs it. They do this in people a lot too. Okay, now we're going to put on the anesthesia, gas anesthesia, inflate the cuff so that the tube has a little balloon on it. So we're inflating it so it's the size of this cat's trachea. Can you take this in? And then tie to the back of the head. And then we're giving them anesthesia through this machine over here. In through this tube, into the cat, down to the lungs. The cat breathes it in, and then it's passed back on out and around again. So I'm going to scrub the area while Sheila hooks up the EKG. Okay, he's making an incision into the esophagus, and I'm poking through and then grabbing a hold of the tube. Pull it through the mouth, and then push it back down the esophagus. turns that way, that means it's down into the esophagus. So this is the cat's head up here. This is the chest cavity. This is the abdominal cavity and the spine here. These are the alligator clips for the EKG. This is the endotracheal tube that's going right into the trachea and the breathing so that we can keep her under anesthesia. And then this is the esophagostomy tube. So we're going to suture to the wing of the atlas. So we go through the skin and grab a hold of the wing, periosteum of the wing. It's a covering right underneath the bone. Yep. So you can't pull up on it, so I know it's in the periosteum. Our first feeding is going to be with water. We'll put just water down there. And the only reason for that, it's sterile water, is because we want to make positively, though I'm positive from the x-ray that it's in the stomach, we just want to take that one last step, making sure the cat doesn't cough or anything. And now as you see, this tube is in here so it can't come out. This cat at home, the owner says, is wonderful, as is really common in cats. Cats will come into the hospital, and I always say to owners, we totally understand when they're very fractious. Most cats now, especially in Wisconsin with our cold weather, they live indoors only. So you think about it, you're born indoors, you only live with the owners, you see maybe friends coming in every once in a while or family, but otherwise they stay in the house. It's not like a dog that goes out, sees other people, sees other animals. So when a cat comes in the hospital, they want nothing to do with the hospital.
Today's show was brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.